Morgan Lanigan and his wife Kelly were at their cottage in New Brunswick when a pain she was experiencing became so severe they rushed her to the nearest emergency room.
They basically said, we're at overcapacity and we can't see you, and that the regional hospital ER is also over capacity as well. So that's when we kind of had to face a really critical moment at that point.
Suffer or drive an hour to Fredericton, where they arrived to another full waiting room. From Vancouver Island to Newfoundland and Labrador, Canadian hospitals have had to turn patients away, clawing back hours and temporarily closing their doors.
We've always viewed our work and our career as being one that is available for you 24/7, no matter what, any time of day. However, we're seeing that we're not able to deliver on that promise anymore.
In Alberta, there have been 19 disruptions to emergency and ambulatory care facilities since the beginning of June. The province's official opposition says new data also shows ambulance response times have worsened and red alerts where there's no ambulances available have increased in frequency.
The system has been run far too lean for far too long.
The Alberta government says its system is not collapsing, but this Toronto emergency room doctor argues it already has.
I see it with my own eyes that even in the urban centers like where I work, the wait times are longer and patients' families are having to make difficult choices.
On Sunday, Montreal Children's Hospital was forced to turn patients away due to overcrowding. And in BC, 4 interior hospitals announced temporary diversions.
I'm hearing now that ambulance crews were unaware and showed up with a patient on the overnight shift and had to, after arriving at the hospital doors in Clearwater, had to divert to Kamloops.
That's an hour and a half away. No matter where you end up, ER physicians are warning there's likely to be a wait.
There needs to be planning, and us on the front lines, we can only do so much. We try to help as much as we can. We lack the power to coordinate the whole system.
That, health experts say, will require the attention of all levels of government. But many Canadians don't have the luxury of time for policy to catch up to reality. Jamie Mauracher, Global News, Toronto.